Good afternoon, everyone. Let's start with the new topic, that is unit number 9, Pharmacoepidemiology. So, these are the contents of my presentation that we are first of all going to see some basic definitions of the pharmacoepidemiology. Then we are going to see what are the different types of pharmacoepidemiology study. Then we are going to enlist and describe methods in pharmacoepidemiology. Then in a separate presentation, we are going to see what is a drug utilization study and the factors affecting it. And lastly, the point which we are going to see, that is applications of pharmacoepidemiology in different areas. Okay. So let's start with the first point, that is some basic definitions. So first is the pharmacology. It is the study of effects of drugs. Then clinical pharmacology is defined as is the study of effects of drugs in humans. Then epidemiology, it is defined as it is study of distribution and determinants of diseases in population. So remember this, in population. And what is pharmacoepidemiology? So it is study of use of and the effects of drugs in large number of people. Okay, so it, in this diagram, or in this, you can see the pharmacoepidemiology is this portion. Okay, so it is nothing but the intersection of the clinical pharmacology and epidemiology. So clinical pharmacology, it deals with the use of and the effects of drugs in the humans. And the epidemiology, it deals with the population. It is population study. Okay, study which is carried out in large number of people. And so pharmacoepidemiology is nothing but the use of and effect of drugs in large number of people. Okay, so it is nothing but the intersection of the clinical pharmacology and the epidemiology. So the types of pharmacoepidemiological studies, there are basically two types of it, that is a drug oriented research, and second one is utilization or drug utilization research. So in drug oriented research, it is for emphasizing efficacy and safety of drug. This type of research is carried out. So these two words are very important, that is efficacy and the safety. So why we carry out? To emphasize whether the drug is efficacious or not. Efficacious means what? Whatever effect we are seeing, that if we suppose that paracetamol is known to decrease the body temperature. Okay, so in whatever dose it is being prescribed, whether it is able to decrease the body temperature or not, so that means that becomes the efficacy of that particular paracetamol tablet. And safety means what? In whatever dose it is being prescribed, whether in that dose the drug is safe or not. Okay, so that is the purpose of drug oriented research. And the utilization oriented or drug utilization research is for aiming to improve the quality of drug therapy through educational intervention. Okay, so what we want over here is that we want to improve the quality of drug therapy. How to improve the quality of drug therapy? By providing education to the prescribers. Okay, so if prescribers are educated well regarding the drug usage, then we can achieve maximum therapeutic effect and minimum side effect or adverse events. Okay, so drug oriented research, unlike clinical trials, they assess drug effects in large heterogeneous population of the patient over longer period and enhance our knowledge about effectiveness and safety of the drug. Okay, so what they do, they differ from the clinical trials. In what criteria they differ from the clinical trials is that first they assess the drug effects in large population. Okay, in clinical trial we have seen that in phase 3 the drug population is limited. It is around 3000 to 5000 patients, but in case of the drug oriented research it may go much beyond that limit. Okay, and second word is heterogeneous. Heterogeneous means what? The population consists of the people with variety of uh, variety of conditions. Okay, in case of clinical trials they are controlled clinical trials. That means in phase 3 clinical trial, which is the largest phase of clinical trial, we include the uh, patients with the target disease only. Okay, but in a real life situation it is not possible that the patient may have the diseases apart from the target disease. So such patient we can call it as the heterogeneous. Okay, that means uh, he that patient is totally different in the physiology or in pathological situation as from that of the clinical trial. So heterogeneity is there. And also genetically not all the people they are same, they are different. That's why when the drug is subjected, you should understand this one thing very clearly, that drug oriented research is carried out when the drug is actually marketed in the around the globe. Okay, so when it is marketed, it can be taken by millions of patients, and when millions of patients are taking the medication, we cannot ensure that each one of them is suffering from the only disease that we are targeting. Okay, so there is heterogeneity among the population which is to be included in this type of research. Okay, and also the third thing in this drug oriented research is that these are carried out over longer periods of time. In case of phase 3, it may take like 2 to 3 years to conduct phase 3 clinical trial, but this drug oriented research may go on for decades. Okay, so as they go on for decades, like the one example which I have had quoted earlier on of diethylstilbestrol, the side effects of it were evident or were realized after 30 years of its usage. So, if we have relied upon the clinical trial study data, then we would have not known about the side effects of the diethylstilbestrol. Okay, but with the drug oriented research like tool which we have in our hand, we can actually find out what are the long term effects of a certain drug. Okay, so under utilization oriented or drug utilization research, we have two types, that is descriptive studies and the analytical studies. We are going to give details of these two type of studies in next few slides. Okay, so what are descriptive studies? They describe patterns of drug utilization and identify problems in the drug use. Okay, so how the drug is being utilized, how the drug is being used, there is a certain pattern of it. Okay, and they describe, they detail the pattern of the drug use, and they try to find out. And please remember this very clearly, that these studies will only be carried out if there is a problem. Okay, if there is no problem associated with the drug use or the efficacy and safety of the drug, then there is no need to carry out the research. But if some problems are being faced by the population who is taking such drugs, then such studies needed to be carried out. So These descriptive studies, they describe the pattern of the drug utilization and they try to identify the problems in it. Okay, so it is not always the drug uh, act as a culprit over here. It is how the drug is being used that also plays important important part in the efficacy profile of the drug. Then second type of studies, that is the analytical studies. They correlate drug utilization data to figures on morbidity, outcome of treatment, and quality of care, with the ultimate goal of assessing whether the drug therapy is rational or not. Okay, so three things it correlates drug utilization data to. First thing is the morbidity, second is outcome of treatment, and third is quality of care. Okay, morbidity means I'll just one second. Okay, so morbidity, the dictionary meaning of it, it is the quality or state of being morbid. Second meaning is morbid quality, disease or sickness, or amount of disease or rate of sickness. Okay, so if the drug which is being utilized, whether it is be able to decrease the morbidity or not, that means whatever sickness a person has, whether it is able to decrease that rate of sickness or not, that is the morbidity. Then second is the outcome of treatment, means whether the drug is able to cure the disease or not, or it is just to be given for the prophylaxis purpose. And quality of care it is giving, means what, whenever drug uh, is being taken by the patient, whether the drug is able to provide the therapeutic results without much of the side effects, that is the quality of care. Okay, so if so happens that there is one drug, suppose opioid analgesics. Okay, opioid analgesics, there are fantastic analgesics in order to relieve the patient of their pain, but they do have certain kind of adverse effects, like that certain uh, opioid analgesics like tramadol, when it is given, it relieves the pain, but it may cause a palpitation and also cause a kind of dizziness feeling, and also can cause the vomiting sensation. Okay, so here, if the patient is taking a tramadol like a drug, then it depends, he will continue with that drug depending on what type of pain he has. That means if he is suffering from the excruciating pain, and in that case he can rather choose taking a tramadol uh, apart from taking that excruciating pain. But if the pain is of a normal kind, and in that case the tramadol like drug is given, then what will happen, the patient, because of its side effects, he won't take the medication, because the it he can suffer, or he can endure that pain he is suffering from, rather than suffering from these adverse effects of the tramadol. Okay, so the ultimate goal of the analytical study is to assess whether the drug therapy is rational or not. So in excruciating type of pain, we can go for the tramadol, but if for normal pain like a backache or something like that, we should not go for tramadol like drug, because it will just its side effects are too much to endure, instead of enduring that pain. Okay, so that is the aim of the analytical studies. So the methods in pharmacoepidemiology. So pharmacoepidemiology applies to drugs and their pharmacological evaluations, the different methods of epidemiology. Okay, so its methodology is therefore observational and thus is usually opposed to the experimental method as defined by the Claude Bernard, used in the phase 1, phase 2 or phase 3 of the clinical trial. So one differentiation is between pharmacoepidemiological study and the clinical trials is that clinical trials, they are of type interventional. That means if the disease is progressing, with the help of clinical trials, they intervene in the progress of the disease. Intervene means what? The clinical trials, they try to reverse the progression of disease, or they try to slow down the disease progression. But in case of the pharmacoepidemiological studies, we just observe that how a disease is progressing. Okay, what are the signs and symptoms are being developed for that particular disease. Okay, so pharmacoepidemiology can be carried out for the disease also, for the drugs also. So if you are using the drugs, then how, what is the effect is being produced by the drug on the body, that is seen by, or that is observed in the pharmacoepidemiology studies. So if drug causes any kind of adverse effect, then we just observe it under this kind of methodology. We don't try to rectify, we don't try to nullify whatever adverse effects are being produced by the drug. Okay, so that is the difference between observational and interventional. Observation, we just observe the disease or the drug effect progression. And in case of interventional, if drug is producing any kind of adverse effect, we try to nullify it. So that means intervening in the adverse drug reaction produced by the drug. Okay, so next is first one is the descriptive study approach, which is non-comparative in nature. So descriptive approach, it observes phenomenon retrospectively, prospectively, and transversely. Okay, so so it means that retrospectively means looking backward, prospectively means looking forward, and transversely means it is looking sideways. Okay, so this approach, it generates hypothesis. Okay, in last lecture we have seen what is hypothesis generation and hypothesis testing. So descriptive study, they generate hypothesis. So they answer the questions, that is what, who, where, and when. Okay, so they are help to characterize who, where, or when in relation to what. So here what means, it is outcome. What is the outcome of the drug treatment? Okay, so who, that is persons, where, place, and when, time. Okay, so persons, characteristics such as age, sex, occupation of the individuals affected by the outcome. Okay, place, geography, that is residence, work, hospital of the affected individuals. And the when, that is when events, that is diagnosis, reporting, and testing has occurred. Okay, so that is all information is being characterized in relation to outcome. Okay, so the types of study designs of descriptive study are these, that is first one is cross sectional, then second one is incidence, third one is ecological, fourth one is case report, and fifth one is the case series. So out of which we are going to study in detail the first one, that is cross sectional. So cross sectional study, the purpose of it is to learn about the characteristic of a population at one point. This is important, at one point in time. It is like a photo snapshot. Okay, so it is photo snapshot means what? You click the photo. So when you click the photo, you take printout of it, then whatever things you see in the photograph, the whether they will change as the time passes by. No, they will remain the same. So this cross sectional study is that only. So at one point in the time, whatever the characteristic of the population, they are being studied in the cross sectional study. So at one particular time, so at 3 p.m. in the uh, afternoon of the date, that is 12th March 2021, what was the position of the fourth year students in uh, studying in the or sitting in the clinical pharmacology classes. So what is, if we study, so that is the characteristic of that population. So we have defined the time. So at that particular time only, what is the characteristic of the population under study? This is nothing but the cross sectional study. So design wise, there is no comparison group of it. Okay, so how we will compare in this cross sectional study? Because we are only defining the characteristic of a one particular population or one particular group of people at one particular time. So there is no comparison group over here. Okay, so the population over here, it is all members of small defined group or a sample from large group. Okay, so we can consider over here that in your class only. Okay, some of the students, they are in the college right now, and rest of the students, they are at home. Okay, so what is the characteristic of the students who are there in the college? It is we cannot compare the characteristic of those students who are there in the college with the students who are at home, because the perspective is totally different over here. The students who are at home, they may be asleep. Okay, they may be wandering somewhere else, but the students who are in the college, they are either in the library, they are either in the computer lab, or they might be in the some laboratory working on some experiment. Okay, so there is no comparison group. We cannot compare these two groups. That's why in cross sectional study, we are only concerned with the one sample of group from the large population, and what we are concerned with their characteristic at one particular time. Okay, so the results of the cross sectional study, it produces estimates of the prevalence of the population characteristic of interest. Okay, so what is the prevalence? So first of all, we have to define, that is, what is our interest in it, why we are carrying out this particular study. So once we can answer this question, why we are carrying out this study, then we can actually find out what is the prevalence of that particular point of interest in the sample which we have selected. Okay, so when to conduct the cross sectional study? So there are certain conditions in which only we can carry out this type of studies. Okay, so to estimate prevalence of a health condition or prevalence of a behavior, risk factor, or potential for a disease. Then second condition in which we can carry out cross sectional study is to learn about characteristics such as knowledge, attitude, and practices of individuals in a population. And the third is to monitor trends over time with serial cross sectional studies. Okay, so in first, what we are doing, why we carry out this, to estimate prevalence. Okay, and in second, to learn about characteristics, and the third is to monitor trends. Okay, so trends of how disease, I will give example of this, what is trends. uh, we have three seasons, that is the summer season, winter season, and the rainy season. Okay, so in winter season there are certain types of diseases that occur mostly, like cough, cold, fever. They occur mostly in the winter season. Okay, and this is the trend that is going on year and year after. Okay, so why this happens? Because that particular environment is suitable for that type of diseases. So when there is no need to actually carry out cross sectional studies to find out this. But if cross sectional studies are to be conducted in such a regard, then we can easily find out that in which season that what disease prevalence is more. Okay, so if we carry out, or if we look upon the data which is collected from the general hospitals, we get to know in season of the summer, now it is summer, which type of patients their number is more. Okay, so this becomes the cross sectional study. So here the time frame is fixed. So if we consider the 4 months of the summer, then it starts from the feb march april may, 4 months of the summer. So we have to collect the data of certain group of population from the general hospital related to the diseases that occur in the summer season. So we get to know the trend, and when we collect the data of of last 5 years or 10 years, we get to know that which diseases are more prevalent uh, in this particular time frame. Okay, so that is cross sectional study. So cross sectional study measures the prevalence of a condition. How to calculate? That is the number of existing cases divided by size of population. So this formula will give us the prevalence of a condition, and size of population can be replaced with the population count. Okay, so next is the incidence study. So in this type of study, newly reported or registered disease cases are compared over time, place, or person. So newly reported example can be taken of the COVID. Okay, so till December 2019, there were no cases of COVID in the entire world. But in December 7 of 2019, first reported case of the COVID was there in Wuhan, China, and then it spread to entire world. So this is the incidence study. Okay, so suddenly in the hospitals of Wuhan, there occurred, or they started reporting newer cases of this disease, who showed symptoms like the difficulty in breathing and all. Okay, so next is population estimates, or the population group totals is used as the denominator. So in uh, earlier formula, instead of size of population, we can go for the or we can replace it by the population estimate or the other population group totals. Okay, so next is ecological studies. So these studies, they obtain group level exposure information and disease prevalence at the same point of time. Okay, so next is the case reports. So what are the case reports? These are the documents, uh, unusual medical occurrences. Okay, So these reports, case report, they document unusual medical occurrences. So they can represent the first clues to the formulation of hypothesis. Okay, so such case report was published by one of the doctor from Australia in relation to the side effects of the thalidomide. Okay, so he reported firstly that such adverse effect can be seen, that is phocomelia, in the newborns who were taking thalidomide. So it helped in the formulation of hypothesis that thalidomide might be the reason for the phocomelia, that is the side effect. Okay, so it generally reports new or unique findings. Okay, so previous undescribed disease can be described or can be reported with the help of case report. Example is given that Zappa Costa, a name of scientist, he presented a case report of patient treated with minoxidil that was discovered to stimulate the hair growth. Okay, so once he reported this, actually this is the adverse effect of the minoxidil, but this adverse effect have now become the main therapeutic effect or the outcome of the minoxidil. So subsequently a topical formulation of minoxidil was developed to take advantage of that effect. Okay, so case series, it is a collection of individual case reports which may occur within a fairly short time. Okay, so when many people or many scientists they start reporting about the same thing again and again, so all these reports they are being collected and that forms the case series. So experience of a group of patients with the similar diagnosis, it is also recorded. Okay, and that recorded data is then put as the case series. So example is given of Krishnamurthy and King. They reported on the adverse effects associated with use of olanzapine in 5 children with severe behavioral problems. So the adverse events include weight gain, so that is 3 out of 5 children they faced this problem, then sedation in 2 out of 5 children, and akathisia in 2 out of the 5 children. Okay, so the advantages that are provided by the case series methodology is that it is useful for the hypothesis generation. Okay, also it is informative for very rare disease with few established risk factors. Okay, then next is it is usually of short duration. So what are the disadvantages of it? That is it cannot study cause and effect relationship. So actually that is the purpose of carrying out these studies, that to establish what are the causes of it, causes of that disease or causes of that particular adverse reaction, and what are the effects it produces. But it case study or case series, it is not able to study the relationship which is there between the cause and the effect. Okay, and also it cannot assess disease frequency. That disease frequency means what? The frequency at which disease occurs. Okay, so it cannot assess that, it is not able to find out that at what frequency a disease can occur. It will just describe the disease, the it will help in the hypothesis generation, but it won't help in the determining that the frequency of disease. Okay, so example can be given of that related to COVID only, that it was earlier expected or some assumption was generated that a person can get COVID only once. After he gets COVID only once and he get treated with it, antibodies are created against coronavirus, and he remains protected for prolonged duration of time. Then it was found out that the antibodies remain in the body for only 80 days. Now some cases are arising in our country also, that a same person is getting infected with coronavirus again and again. Okay, like 2 to 3 times a same person is getting the COVID. Okay, so this is the like shortcoming of this case series. Okay, although it has certain advantages also, but it is not able to define exactly the frequency of disease, that how many times, how much protection the antibodies can provide us against the coronavirus disease. Okay, so these are the shortcomings of this case series. Okay, so with that we will finish over here only. In next lecture we will start with the analytical study designs. Okay, thank you.